Hi there, I'm Michael Drake, a member of the Howick Baptist Church, and I have with me Heather Astell, a member of our congregation also. And Heather, you're here to talk to us about COVID-19. So who are you and why should we listen to you?
Hello, I'm Heather Astell. I'm a geriatrician and general physician at Middlemore Hospital. And so my job includes caring for hospitalised adults who are admitted with conditions such as pneumonia. And so I expect that as the number of people with COVID-19 increases, that I would be involved with caring for them.
Yep.
I'm speaking today as an individual health practitioner and not as a representative of Middlemore Hospital. And the information that we'll talk about today is always changing, and so I encourage you to look at the Ministry of Health website for up-to-date information.
Great. So what is COVID-19?
Well, COVID-19 is a virus in the coronavirus family, which means that it's related to SARS, which had an outbreak in 2002, and also to MERS, which is an ongoing problem in the Middle East. It's also related to some milder viruses, which cause the common cold.
Where did it come from?
Well, it was originally thought to be an animal virus, which then changed and became infectious to humans and started in Wuhan in China and is now spread throughout the world.
And the symptoms, how do we know we've got it?
So the symptoms involve a high fever, such as temperature more than 38, a cough, shortness of breath, and a runny nose or sneezing. So it's actually really similar to a cold or the flu. So having these symptoms doesn't necessarily mean that you've got COVID-19.
So if you don't, how do you know? How do you find out?
Well, it's diagnosed by having symptoms that are consistent with COVID-19, also having some exposure to the virus, such as travel or exposure to people who've had it, and then it's confirmed by a swab up the nose.
Oh, so that's how it's diagnosed, but how's it spread?
So it's spread by droplets, which means that if someone coughs or sneezes and you breathe in those droplets, you may catch it. Also, if someone coughs or sneezes onto a surface and then you touch the surface and then touch your eyes or nose or mouth, you may catch the virus. Also, the virus can live on surfaces for up to 3 days, depending on what the surface is.
So surfaces like door handles?
That's right.
Oh, okay. So how serious should we take this? We know there's a lot of deaths, but there's a lot of deaths from flu every year, and there's a lot of rumours going around. How serious is this?
So this is a new virus, and so our community doesn't have existing immunity to it, which means that if we're exposed to this virus, we're quite likely to catch it. Most people, more than 80% who catch the virus, will only have a mild illness and they'll get better. But for older people or for people who have other health conditions, especially things like heart disease or lung disease like emphysema or COPD, or people with low immunity, that catching this virus can be very serious. For people who have severe symptoms, the risk of dying is quite high. The exact risk of dying from COVID-19 is hard to estimate, as the mortality rates vary from country to country, and that's probably depending on different health systems and different rates of people being tested. But for most people, the risk will be less than 1%. But as I've already said, for those people who have other conditions who are more vulnerable, the risk is significantly higher. Our hospitals already run at full capacity, especially over winter time, and they are planning for how they will manage the extra patients. But we can expect that if a large number of people in a short space of time.
So if you get it, how do you fix it?
Well, there's no specific treatment, but most people would just get better with supportive care at home in the same way that you would recover from a cold. But for some people, they will need hospital admission. Antibiotics don't help against viruses. A vaccination is being developed, but they will take some time.
Right. So if you can't treat it very effectively, the best thing is to not get it.
That's right.
So
yeah.
How do we prevent it?
So we need to prevent the spread of this virus. So if you're sick, it's really important that you stay home from work or from interacting with other people for 48 hours until you've been well for 48 hours. Stay home for 2 weeks in self-isolation if you have been overseas recently or if you've been exposed to COVID-19. And call Healthline and register with them, and they will tell you what to do. Self-isolation means not going out and about, not having, so you need to stay in your own property and not have visitors. And if you can get food and things delivered to your doorstep, and then you can collect it from there. It's important to wash our hands regularly to prevent touching our face and transmitting the virus to ourselves. If you cough or sneeze, it's good to do that into a tissue and then to dispose of the tissue and wash your hands. But if no tissue is available, cough or sneeze into your elbow and wash your hands when you can. Avoid touching your face if you can, as this can reduce the transmission of the virus. And you will have heard of social distancing, and this means trying to stay about 2 meters away from other people. Don't hug or touch or kiss people, and avoid big gatherings. And this is why various sports meetings and the Polynesian Festival recently have been cancelled. Social distancing is not only important for our own health to prevent us catching it, and I think that's most important for those more vulnerable people, the elderly and people with other medical conditions, but also for the community as a whole. For those of us who are least likely to catch a severe illness, we're less likely then to transfer it to those who are more vulnerable. And I think that we can see this as a form of loving each other, of making some sacrifices in our own life for the benefit of others. It's important though to keep in social contact, so social distancing doesn't mean social isolation, and we can use the internet or telephone to keep in contact. And it's also a good idea to get vaccinated for the flu, as this results in less hospitalisation and so on in general, and hopefully less exposure to the virus.
Right. The flu vaccine won't prevent COVID-19.
No, it's completely different.
But it improves our general health.
It improves our general health, reduces your risk of needing to be admitted to hospital.
Okay.
Yeah.
Now you're not wearing a mask.
No.
Why not?
So masks aren't recommended for healthy people and people who are not in contact with sick people. Masks are important for people who are caring for sick people to protect the carer. They can also be useful for people who have the virus to prevent coughing or spraying it onto the surfaces around them. But the mask gets infected, and so if you touch your mask and then touch a surface, you'll be transmitting that virus. So masks are not reusable, and they need to be disposed of properly, and you need to wash your hands after touching the mask.
So are you saying that a mask is actually collecting and reading? That's
right.
Oh, okay. I'm not wearing a mask. So if you think you've got it, what do you do?
So you should call Healthline or your GP practice, and they'll tell you what to do. Don't go to the GP practice or to the hospital without them telling you to do so.
Right. Now, you're a specialist in the care of the aged. What, from your perspective, what special needs do they have, and how should we care for them?
Well, I've noticed that many elderly people are more reliant on social services and people around them, and so if they're in social isolation, they might become very isolated socially and not be able to talk to people, but also not get the things, the physical things that they need. So I think it's really important that we keep in touch with these people around us and check that they're okay, and if there's any way that we can help them.
Look, thanks, Heather. The big thing is, if anyone needs help within the church, get in touch with us at church.
Yes.
And if you think you need help with COVID-19 or something, ring Healthline.
Yes, that's right.
Okay. Thank you so much.
All right.
We will pray.
In New Zealand, we've only had 39 confirmed cases, and all of these people have had contact with travel.
Excuse me. Pardon me. We're going to have to
edit that bit out.
It happened to me yesterday. No, the day before I went for a walk in the hot sun, and then went into the shopping centre. And the air conditioning, and I'm sort of coughing and starting to sneeze, and excuse me.
That's all right.
Right, so
I'll start there again.
Yeah, start that one again.
So this is a new virus in our community, and so we don't have existing immunity to this virus. So there's a high chance that if we're exposed to it, that we'll catch it. In New Zealand, so far, we've only had 39 cases, which means that our chances of catching it is quite low, because all of these cases have been exposed or have been caught through travel or exposure to people who've already had it. But if community transfer starts happening, as it has happened overseas, then the likelihood of catching it is much higher.